here, and I'm with Dr. Simpson and Dr. Kinzer from Jackson Creek Dental. Good morning.
Good morning.
Good to have you guys.
Yeah, excellent.
Yeah, it's nice to be here and not getting my teeth examined.
Oh.
You guys are matching today. You look great.
Thank you.
Yeah, and you're here this morning to talk about your trip, your awesome mission trip to the Dominican Republic. What was that like?
Oh, it was fantastic. We brought, 55 people? Yeah.
Wow.
We had 35 youth and then 20 adults that came along. And we went down end of March, right?
End of March into April.
Yeah.
And so it's a couple of weeks, or?
Yeah, it was a couple weeks.
Yeah.
Went down there to build a church for the community down there. The area we're in was a very depressed area, of course, in Santo Domingo, and built a church and ran Vacation Bible School, and then ran a dental clinic with 4 doctors. Yeah.
How rewarding was that? What was that like?
Very much so. I mean, there's need everywhere in the world, but to see it firsthand and to experience it, and they were so thankful. I mean, I think where it really touched me was when, because one of the doctors was a local doctor that joined us, and we were halfway into this, and you're faced with challenges, and he just had like a tear in his eye. He goes, "Why would you come all the way across the world to help us here?" And I said, it's just our opportunity.
Wow. The world, when you think about that, it's a small world, isn't it?
It is.
And we're all human, and we all have needs, and to be able to meet those needs for the poor must be such an incredible experience. So you worked on teeth, a lot of teeth. How many mouths do you think you were in?
we estimate we saw about 700 people.
Oh my goodness! Yeah. Wow.
In 4.5 days.
And some of these kids probably never seen a dentist. Is that right?
I think not a lot of dentistry. Certainly. I think they're just, if there's pain. Most of the treatment they get, there's extractions due to pain or discomfort. Very little preventative care, like cleanings and fluoride treatments, and certainly not a lot of fillings, restorative work.
I had emailed a doctor that we were working with from the Dominican Republic. He helped us out, and emailed him ahead of time and asked him about the needs of the area. And he said that there were quite a few mission dentists that came down and helped out in that area, but it was all pretty much just extractions that they would provide. And I've done that before, and it's an easy thing to do. You have to bring very few supplies to do that. But we brought 15 bags worth of stuff to be able to do fillings and root canals and things like that. And I remember one comment that was made when we were there was saying these people never get this kind of work, that they can't afford it.
No.
It's not available to them, and so for them it was a real luxury. And usually what they do is they let a tooth decay until it's ready to be taken out, and then when a mission dentist comes in, they take it out. So they never have the opportunity to actually get something as simple as a filling.
The things that we just take for granted.
Definitely.
Definitely. So then you said VBS, so you have interpreters there then? So you're teaching and then they're interpreting for you?
Yeah, we had a few of our youth that knew Spanish, and they were interpreters there. Yeah, so we did Vacation Bible School for 550 kids, I think.
Something like that.
Yeah.
Outside?
They planned on 200.
Oh my gosh.
But it was huge.
As I love to hear how God's word just compels people.
Definitely.
That's awesome. That's awesome. So the kids, I mean, I've never been there, but some of the things that you see when missionaries go into other countries, and just the joy that some of the other people in other countries have, yet they're poverty-stricken. They seem to have this joy. Is that what you experienced there?
Yeah, you think, oh my goodness, they have very little, but we look at it from our perspective. Like we have so many things, and so many possessions, and so many things available to us, and where there it's such more simple, yet they're just as happy. They may be happy with making a tape ball as a soccer ball.
So what's the one, I'm going to ask each of you, what's the one thing, and probably many, but what's the one thing that you took away from this trip? Because I know you've done other trips like this, but what did this trip show you?
community support, definitely. I mean, just having a very close, tight-knit community. Nobody has cars there. They can't, I mean, there's a few people, but for the most part, they don't have cars, so we had to do everything very local.
Yeah.
And I went down the pre-trip to do the planning, and it was just amazing to see how the community would come together to support the needs of your coming.
Love that.
And it was neat how just doors opened up. Even the clinic that we ran in the home of a guy that was building a house, and he was building it when we were there, and we were talking about our needs on the street, and he came over and offered his house.
Oh, I love it.
And it wasn't done yet, you know, but it had tile floors and counters and everything. It was perfect.
Perfect.
But, yeah.
That's awesome. Okay, how about for you?
You know, for me, we were going down there. It was just the doctors. Sometimes we'll bring some of the staff with us to help us run the clinic, and so part of the ministry was to work with. We had brought 36 students, I think, or 35 students, so juniors and seniors, right? And we decided to use them as our assistants and help set up and all that. And I was nervous about it, and I'm going, how are we going to get anything done? And so to see them, they all stepped up, and to see their experience. So it wasn't just their giving and seeing it, but to be able to be involved with dentistry and maybe change a profession for them.
There's two of them that want to go into dentistry.
That was pretty exciting to see their excitement in their eyes to see tooth come out.
And was this some of the kids? Was it their first time being involved in something like this? Some of the kids you took with you?
So,
So they must have been completely blown away by the experience.
It's definitely an impact on them to see that.
Now, is this something you do every year?
Every other year.
Okay.
Yeah, 2 to 3 years. You know, I know each of the doctors in our group, look to do this in Costa Rica and Africa, and where you've been to Roatan and.
I love how you guys are both, I just really want to commend you. I just love how you're both using your profession to make a difference and to spread the gospel and to help people. It's so awesome. It must be.
There's plenty of people up here doing that, and it's awesome. We have to do that.
Yeah, exactly. That's what it's all about.
Whether it's local or overseas, opportunity's certainly there.
Yeah, because you guys have done local work too, haven't you? You've done these clinics at your office and other dentists involved. Yeah, Smiles for Kids.
School screenings and certainly involved in a lot of different programs.
Because we don't want to underestimate or devalue the need that's right here too.
Well, the community here helps us be able to do that too.
Exactly. So Jackson Creek Dental has a heart. Good. And so thank you so much for being on today. Is there anything that you guys want to share? Anything in addition you guys want to share about it, or?
Cut me off guard.
What did we touch on? I mean, is there anything else that you really wanted to?
I think that was a lot. I think a lot of it is that we're not the only ones doing this. There's other dentists in the community have been involved, and whether it's locally or overseas, and this certainly we appreciate the opportunity to share our experience. But it's just one of so many opportunities that other professionals have done. I know a lot of physicians, they do a lot of trips overseas and surgeries, and so it's just it's a real opportunity to be a part of that.
Thank you so much for being on today, guys. We're going to take a break. We'll be right back.